You're listening to Single Payer Radio in Louisville, Kentucky. This is broadcast on WFMP LP 106.5 FM on Mondays at 2 p.m., Tuesdays at 7 a.m. if you're one of the early risers, and Wednesdays at 11 a.m. Or you can listen live at those times at forwardradio.org. The shows are also archived at that website. I'm Kay Tillow. I'm with Kentuckians for Single Payer Healthcare. You can reach us at kyhealthcare.org. We're working to bring care to every single person in our nation, and we think that the people have to find a way to make that happen because it's the right thing. The views expressed on this show are those of the speakers and not of the station. And we're really pleased to have with us today two members of the County Board of Supervisors in Dunn County, Wisconsin. These two people and others in their county have put a referendum on their November ballot that relates to providing federal not-for-profit healthcare for everyone. And I'm going to introduce them and then let them tell the story about what they did and why they did it and what in the heck is going on here. Monica Barrier is a community organizer and a member of our Wisconsin Revolution. She pays the bills by working as a philosophy professor and serves on the leadership team for her union local. She is in her first term as an elected member of the Dunn County Board of Supervisors. Welcome, Monica.
Thank you. It's good to be here.
And the other person is John Calabrese, is a woodworker and organizer with our Wisconsin Revolution and a member of the Dunn County, Wisconsin Board of Supervisors. So we have elected officials here. So can you tell us what is going on in Dunn County?
Sure, thank you, Kay. It's really great to be here. And we were very excited when you found the article and the story and reached out to us. And we're excited to tell it to all the people who are listening. And in actuality, the story is just getting started. And we hope it has a long way to go. And Dunn County is a rural-ish county over in the western side of Wisconsin, about 75 miles east of the Twin Cities. To put it in perspective, there are about 50,000 people living in Dunn County. What's the number, Monica?
It's about 45,000.
45,000 people.
Yeah.
And so it's a small, rural, conservative-leaning county that went for Donald Trump. And on the county board, there are 29 supervisors in this small county. It's one of 72 counties in Wisconsin. I've been on the county board this will be my 5th year now, so 2 terms plus another year I was appointed in the middle of a term. And what I found, as someone who had a background in state politics, following it, running for office, and then following national politics, what I found at the county level was really eye-opening, and I was pleasantly surprised. And so in this conservative-leaning county, then it makes sense that many of the people on the board would be conservative-leaning. However, in my tenure there, I have never gotten into anything even approaching a rancorous political discussion. They are there to simply do the job of the board, to be stewards of taxpayer dollars, to get things done that the citizens expect, provide the services that they need, keep the roads plowed, keep the roads paved, keep the jail open, keep the sheriff's office moving, keep the nursing home in operation in Dunn County. And so what I noticed on this board is a big part of the deliberations for the entire year are about the budget. Wisconsin state statute says that counties must balance their budgets every year. And so throughout the year, all the varying departments offer forth their budgets, and then the board has to make the difficult decisions of what to cut. And it's usually cutting because the cost of everything is going up the state legislature is not raising the amount that they put into counties, at least not at the rate to keep up with the rising costs of everything. There are several laws in Wisconsin, including what they call levy limit laws, which really limit the ways that county governments can raise revenue, and a myriad of things. And so it's tough to make those cuts. And so the people who follow and track the budget all year long and the expenses, they see how much health insurance costs Dunn County is paying out each month for their employees. And I used to be on the administrative committee. I am no longer on that committee, but every month that committee would audit the vouchers for the county. And you would see every dollar that the county spent each month. And I was noticing that on health insurance, each month in this one of 72 counties, Dunn County was spending on average $400,000 to $600,000 a month. So about $500,000 a month. About 10% of the entire budget of the county was going to health insurance costs. And so I would see people on this board and on that committee, perplexed by that and frustrated by that. And at the end of the year, we were parsing through $100 here, $1,000 here, trying to balance that budget when every month $500,000 for health insurance. And so with this group that we're with now, our Wisconsin Revolution, we were trying to figure out ways to put some political action in motion that would give people a place to put their energy that could have some tangible results. And I had the idea about going to engage on a healthcare level with county governments. And I wasn't exactly sure how that would be and what that would look like, but I knew that everyone is concerned, and everyone on those boards knows the cost of health insurance. And so through our committee on our Wisconsin Revolution, the idea was brought up to maybe bring a resolution to county boards about a national nonprofit health insurance program. And then the chair of that committee, Steve Carlson, suggested a referendum question to put the question to the voters. In Wisconsin, voters can put forth suggested referenda to the county board. And if the county board deems it so, they can put it on the ballot for the citizens to vote on. And this particular one made it through the committee, made it through the county board unanimously, both votes. And we can get into how that went down and the particulars of it and why we think it happened. And so now that referendum question, and we'll read that to you too, is going to be on the November ballot in Dunn County, Wisconsin. And the language is, and since we're saying it now, I might as well read that to you now. This is what the voters of Dunn County will see on their ballot as question number 1. Shall Congress and the President of the United States enact into law the creation of a publicly financed, nonprofit national health insurance program that would fully cover medical care costs for all Americans?
Wow. That's a mouthful. And we'd like to hear a little bit about how it happened. Did you want to tell us more about Dunn County, Monica?
Sure, I can cover a little bit more about the demographics for sure. So what is really fascinating about Dunn County to me is the diversity. So there's the county seat, its largest city is the city of Menominee. Its population is about 16,000 people, give or take. It's a college town. One of the branches of the University of Wisconsin is here in Menominee. So the student population varies a lot depending on the time of year. But yeah, there's a lot of diversity in terms of the kinds of jobs that people have within Dunn County, right? In the areas outside of the city, of course, there's a lot of farming, crop farming, but also livestock, dairy, of course, this is Wisconsin. But within the city, there's also a broad range. So there's, of course, the university workers, a lot of professors, a lot of support staff. Food service is a big area, one of our largest employers. But then also there's a lot of manufacturing jobs and factory type jobs too, right? So I have a list of the largest employers in Down County. So the largest is the Walmart distribution center. Yeah, second
Yeah,
largest.
with
The
those
second,
high wages, right?
right. Yeah. Yeah. There are so many people that I know who are raising families, trying to work second and third shift jobs here in Menominee. It's a tough life. So there's the Walmart. The other one is the Swiss Miss plant. So Swiss Miss is based out of Menominee, the cocoa that everybody drinks. And then we've got Philips Medisize, 3M, some windows. There's just a lot of low wage manufacturing here. So as you might expect, given the dominance of this, we're a pretty poor county, relatively speaking. So the average or the per capita income is about $45,000 a year, which is pretty well below the average in Wisconsin, which is 55. So Dunn County is 45,000, Wisconsin is 55,000. And then Wisconsin is low compared to the US, which is $59,000. So this is important, to know about the relevance of this referendum to the people living here. There aren't a lot of people that have good health insurance, and even the ones that do have health insurance, we can talk about it. It's not a great system.
Yeah, you spoke about that at one of the meetings about that despite the huge sums of money that the county is paying for health insurance for your employees, that you didn't think it was a great deal. Could you elaborate on that?
Sure, I can. Why don't I back up a little bit and kind of tell the story more about how this started? Because it's really, it was really the result of grassroots organizing. So how this whole thing started way back in, I think, June. There was a citizen of Menominee, a retired physician, who is working with our Wisconsin Revolution. She went to, a county board meeting and, read that petition. And anyway, they promised to take it up at the next meeting, wanted to be responsive to this request, from the citizens. And so, yeah, I did speak at that meeting. I'm not a member of the committee that it went to. It went to the legislative committee, which I'm not a part of, but I had things to say. So I showed up during the public comments along with everybody else. There was a good group of how many people, maybe 12, 15 citizens showed up to speak at that meeting in favor of the referendum. And most people had stories to share about their experiences with healthcare and how inadequate it is. But I wanted to kind of take a different approach as an elected official. And not, repeat those stories, which are important, right? But I wanted to add something different. And so I, as John said, wanted to focus on the budget and sort of appeal to the budgetary sense of the people on the committee. So, yeah. What's kind of fascinating, I just found this out about the Dunn County, the health insurance system that they're using. It's different than what people typically get with their jobs. So Dunn County within the past year switched to a self-insured model of insurance. So basically what happens is the county is putting some money in a pot and paying out the medical claims with their own funding. So it kind of takes, yeah. So this is really, really neat because it's taking like the insurance middleman out of the equation. Yeah, it's self-insured, but it's, we uses the word insurance, but it's a very different model. And so what they're getting actually in reality is much better than under a traditional insurance system where you have that for-profit middleman managing everything. And so I can talk a bit about that because this is a great example, I think, of what healthcare could be, in the United States if we didn't have private insurance, for-profit insurance in the way. So
how many employees does the county have? You have a big enough pool that you are able to make that work?
Right. So there's about 300 employees in Dunn County, which isn't a huge pool, right? So the way that they manage the risk here is you can buy what's called stop loss insurance. So if somebody has something really catastrophic, like a long-term cancer treatment or whatever, you're not going to bankrupt the county. So that helps mitigate a lot of the risk. But as far as like the day-to-day care that the county employees get, they are contracting their primary care with a direct pay provider. And so they pay a membership fee for each employee and their family. And with that, they get in exchange primary care services, urgent care services, like if a child gets strep throat or an ear infection or whatever, also labs and some preventative services as well. And so that's all covered. And there's a clinic right here in town that they can go to, and they can access the providers really easily, right? So like if you need a sports physical for your child, you can get it tomorrow, right? Instead of waiting, 3 months, that those of us that don't have the privilege of being a part of this program, we have to deal with that. So so from what I understand, the employees are actually really happy with this, and the county is coming in well under budget every month with this program. So it's a pretty sweet deal. And yeah, just shows what is possible when we get the insurance middleman out of the equation.
Well, that's an interesting perspective. My experience with that as a union person is that there are lots of unions who try to do that, but that they have many of those funds have gone under with the stress on our system that is full of for-profit entities everywhere, that is stressing to the max all of the fine efforts of the people who are trying to cover everybody in a time when we have a system that doesn't really act to cover us. So I would be interested in knowing how it is that you got a unanimous board decision on this what is considered around the country to be a controversial issue.
Yes, and that is exactly what we're trying to change. Obviously, the main goal is to get everyone covered and to have a nonprofit system, but the perspective of people thinking that this is controversial is what is really driving this movement here. And when that changes, I think the system will change. And so I did not expect a unanimous vote. It was sort of a perfect storm of things that happened to get there that has been really fun and interesting to analyze since it happened. And it happened relatively quickly. That the person that Monica mentioned, Dr. Laureen Vedder, she has been a fixture in this community for many years, and she has a group called Community Conversations, and she prides herself on being nonpartisan, and that has resulted in she tries to hold monthly meetings, and they happen almost every month, and where she brings in a guest speaker and they discuss a certain topic, and it varies all the gamut of topics, and mostly political type things, but from agriculture to healthcare and everything in between. And so she has developed a group of citizens who are loyal to those meetings, loyal to this group. There are conservatives in there. There are Republicans and Democrats and more progressive people all in that group. And I've been to many of those meetings. And so Laureen managed to put the word out about this referendum question to those people. And many of them responded quickly and put together a statement to give to this committee. And that's the other thing about this issue, that because of the predatory horrors of this system, it's hard to find anybody who doesn't have a story to tell about it. And even if it's not catastrophic and life-changing, those stories are at the least incredibly frustrating and annoying and time-consuming. And so first, as Monica said, Laureen brought it to the executive committee. They heard her, she asked them, and she pointedly said, and this is a thing that we think really appeals to supervisors, and as supervisors ourselves, we know that it does. It gets to your heart of why you're doing this. The Dunn County Board of Supervisors don't get paid for their work. We get a per diem per each meeting, and that's not why people do it. They do it because we care about the county and we care about the citizens. And so Lorraine, she introduced it and said, we appeal to you because you're the closest body of government to us, and you are responsive to us, and we trust you to listen to us. And I can see people in that room actually listening. And that's the other thing that's so wonderful about this board is people listen. I have seen people come into meetings with their mind made up one way, listen to some testimony or a presentation of a department about a budget change, and they completely change their mind because they listened. They're not beholden to the interests that they are at the state and federal level. And so she appealed to that nature of the board, and they put it on the agenda for the legislative committee, which was meeting the next month, which is the committee that talks about the legislative agenda that each county will present to the state legislature. And so we thought maybe that was a good place under the purview of that committee. And then Lorraine organized several speakers. It was on the agenda that June. And when we went into that meeting, I had talked to some of the supervisors beforehand to see what they thought of it. And many were dubious of it because they thought, what is this going to do? What can Dunn County do about this national health system? And what is it under the purview of the board? Why are we even discussing this when we have other things to talk about? And my comments to them, and then in the committee hearing as well, was that what we're trying to do is to start a conversation. We want between now and November for people to find out that this is on the ballot, and then just have a conversation about what it means and what they think. And so it was, in my mind, it was a three-pronged approach that happened to get the unanimous votes. It was one, it was the people coming to tell their stories and imploring the board, the committee, and then the board to put the referendum on the ballot, not in total agreement with a national not-for-profit health insurance program, but in agreement that this many people, this many neighbors and citizens, and it's a tight enough knit community that a lot of the speakers know a lot of the board members. And they, instead of just saying, we need this system fixed, we said, we're asking you to put this question to the voters so we can start to have this conversation. This system is unsustainable. It's not going to last for me and for my kids and my grandkids. And if you, as our elected officials, can start this conversation, then it can shift. And so it was the people. It was appealing to the better nature of the board as representatives. And then when Monica spoke, it opened up the eyes of some of the board members who did not know the financial costs to the county. Many of them are maybe not on the particular committees that know those numbers. Many were new board members. And it's stunning when you hear those numbers that are put forward. And I don't know how many prongs I've mentioned in the approach. Maybe there were 4 or 5 too, but another one was the language that I read of the question itself. And in our healthcare committee on Our Wisconsin Revolution, we spent some time figuring out which language to use. Because as you mentioned in the beginning, Kay, about rural America, or maybe this was before we started to record, but there is a sense that this is a political issue and that the people in rural America might not understand it fully, but they've heard something wherever they get their news, and they think that Medicare for all, single payer healthcare, universal healthcare, those have become buzzwords, and they've become very politicized and very polarizing. And so even if people don't understand exactly what they mean, many politically minded people who take in any news might be really turned off by that language. And that's why we specifically did not put any of those terms in the question. And it led to a very interesting conversation. And after the testimony of the people, we had a great deliberation on the legislative committee. And I remember saying to the rest of the committee, when I sort of sensed that it might not pass, and I appealed to them and I said, what I've noticed is, and I said some of this after the meeting too, just because I love having these conversations with the fellow board members. I said, we're just trying to have a conversation. And I said, and something I have noticed in all of these deliberations, and I know the people speaking on the committee and on the board run the gamut, like I said, from conservative over to the other side. I said, nobody has started their comments about the potential of this referendum with, I really love the system that we have. Every single person starts out by saying, look, I know we got a lot of problems. I know that this isn't perfect. I know we spend a ton of money, but should the board be doing this? But what difference would it make? But how much would it cost the county to put this on the referendum or on the ballot? So those were the questions, but every single person who started speaking acknowledged that this system is broken. And that was really pointed to me. And I said, your constituents look up to you. And so now between now and November, they might see you as their libertarian friend at the bar. They'll say, you voted on to put this on the ballot. And then you can explain to them like, yes, I want to have this conversation. And then the conversation will build from there. And so it got through the legislative committee. Dunn County fancies itself, prides itself, I should say, to be a consensus-driven board. If at all possible, we like to all be together. The work is done in the committees, and then we bring it to the full board.
Well, that's amazing.
Yeah, it really is. And it's hard to believe if you haven't been there, given the political rancor of other governmental bodies. And it got to the full board, and another couple of magical things happened. It happened to be the month that the Health and Human Services Department was giving their annual report. And they spoke of, and so this was after the public comment at that board and after discussion of what people were talking about the referendum. And the Health and Human Services report showed how much money Dunn County has to pay in emergency management systems and in their departments that handle medical emergencies. A lot of that money comes from the county, and it's coming to people who aren't covered, citizens in the county who have no health insurance. And so the county, because it's mandated to provide some services by state statute, has to cover several things for the citizens of Dunn County. And one of the more conservative members of the board, and who would probably tell you so, he looked at those numbers that we were spending on those particular services, which there's not even about the health insurance for the employees. It's about paying out services to citizens of the county who don't have health insurance. He said, and he pointed to the back of the room of all the people who had spoke, and he said, would that thing that they're talking about be fixed, or would we have to pay all this out if that was implemented? And the Health and Human Services director said, yeah, that would fix this if it ever happened.
Wow.
So that just so happened at that meeting, and we had a few more comments, and really appealing to, we are the servants of the community. This many people want to have this discussion between now and November. Let's do it. And it passed unanimously.
That was in the legislative committee?
Well, I kind of put them both together. It was first legislative, and then that part that happened at the end about Health and Human Services, that was the full board, which was 1 week later.
And how many people are on your board?
There are 29 supervisors, and at that meeting, there were 27 present.
That's a lot. Our county governments are much smaller here in Kentucky, so that's a lot of people. So it's quite a deliberative body to be considering that question. It
is. And yeah, Wisconsin, the number of supervisors varies from county to county, but they do have good representation. And so those are the highlights of what happened at those meetings. And another thing that Dr. Vetter did that I think was very moving was, in that room at the legislative committee and at the county board, about a dozen people spoke, but many more came just to be there. And so the back of the room was filled, and it usually is never filled. Most times there is zero public comment. And in her public comment, she used her time to ask if everybody in the room who was in favor of putting this on the ballot in November would stand up. And all the supervisors turned around, and every single person in that room stood up. And it was really moving moment, and to let the supervisors remember who it is that they serve and just what it is they're doing.
That's an amazing story. With all the cynicism that we face in our country about a broken political system, that it is possible that citizens can do things that can influence and can change it. Could you tell us, has there been a response from people? What have you heard since this happened? Has there been any comment or response from people?
Well, right now we're working really hard to get out the word and let people know. Those that I've talked about it are really excited about the idea, excited and surprised, right, that we here in Dunn County are doing this, that a rural county like ours is doing this. So it's really exciting to be breaking ground here and breaking down like prejudices that people have about what politics in rural America really looks like.
That's great.
Yeah, we're going to be working on we're in the process of working on a campaign to get the word out, because it's not, given the small nature of the county and our budget, there is not a lot of budget for promotion of the county, and we're trying to move in a direction to help promote the good work that the county does, because people just don't know. And there wasn't a big announcement yet about this question being on the ballot. So that's up to us at our Wisconsin Revolution and for the community members to get the word out and to start that conversation. And what we find so perfect about this topic is that it is an issue that affects everybody. And if we're going to people's doors or having talks at coffee shops and without the Democrat or Republican name attached to us, and just as our neighbors, then we can actually have these conversations. And so I've heard people ask already, why is this on the ballot? What's it going to do? And I've had an opportunity to have conversations with those people, and you can always ask the question, what do you think about our health insurance system? How's your health insurance? How's your care? How are your parents? And everybody will have a story. Everybody knows of those flyers that you see up at the bar, and there are several bars in Wisconsin, if you don't know, and for fundraisers. And we're having a fundraiser for this person's cancer treatment. We're having a fundraiser for this child who fell and broke his leg. And everybody knows those. They are ubiquitous across Wisconsin and likely the whole country. And so if you start talking about those things with people, if you frame the conversation about how do you think it is that we've learned in this country that health insurance is tied to your job, or that it has to be this ordeal that when you turn a certain age, you have to enter a pool and sign up for this and sign up for that, and think about all the stress, the undue stress that just hangs over everybody if they're uninsured or underinsured, and what we put up with in this country. And if you have time in these conversations and you frame it a different way, people will start to think of it differently, and they'll ask the questions. They'll say, who's going to pay for this, and what about my taxes? But anybody who hears me talk about this will always hear me mention the fire department example. And that is one that I will say to anybody who has this conversation with me. I say, what do you think of the fire department? And people will ask, what do you mean? We need a fire department. And that's what we want to do with this conversation, is frame healthcare in that way. Everybody needs it. Everybody is going to need it. Everybody needs to be covered. And so how are we going to do that? That's what you do. We need a fire department. We have to put the buildings out, or it's going to spread and burn down the whole town. And so taking the political buzzword language out of it and reframing the conversation is where I think it has to start. And we're having a good response so far. And there's been some good media coverage, people talking about it, surprised about the rural conservative leaning county that put this question to the voters. We've had interest in other counties about putting similar referenda on their ballot for the spring elections and for next fall. And it might be idealistic, but it feels like you're doing something tangible. And it feels like that I've already seen the conversation change with fellow board members and with some neighbors. I have neighbors all around me who I know vote conservative and had Trump signs in their yards, but I get along with them just fine. And they know my political leanings, and I'm not saying that we're all going to get along and agree on 100% of everything. That's not how it is. But we're all living in the same place at the same time, and we all agree that it would be nice to be healthy and to not be stressed about that all the time.
You know, the fire department example is really one I think that strikes home with people, because everybody knows, you know, if your house is on fire, there's no time to ask the question about, do you have fire insurance? And let us check that out before we save your child who is upstairs in the flames. And that really is, you know, life and death in many ways, just like the healthcare system is. I was amazed at the variety of testimony that your citizens gave at the meeting. Some of it was highly informed health policy, you know, explaining to people that our country pays twice as much as other industrialized countries, and yet our outcomes are worse, and our statistics on maternal mortality and infant mortality, you know, all of those things. I mean, they particularly concentrated on what we have, this new horror with life expectancy going down. You know, that hasn't happened in our country, you know, it's been an issue of progress. And now we're going in the opposite direction, so that we live, I think, about 4 years less than the average in other industrialized countries that have a system of healthcare that really covers everybody. So it was really good. But, you know, one of the other things is there was the woman who said, people in my family can't retire sitting pretty because of the healthcare bills that we've had to pay that have destroyed the savings of our family. And it was a very moving kind of revelation, I think, that, you know, every aspect of people's lives is tied up to a healthcare system that we can't afford, and that doesn't cover us all, and that causes great tragedy in everybody's lives. So it was kind of an amazing thing. I listened to the videos of all of your meetings and tried to understand and to make out what exactly was going on.
Mhm.
Is it going to be on the ballot in other counties, you think, or do we know that?
It's not going to be on the ballot in other counties this November, because it takes time to get from one committee to a board. And I think Wisconsin statute says that it needs to be approved by a county board 60 days before, a full 60 days before the election, or maybe 90 days actually. So it won't be in November except for Dunn County, but we do plan on moving it forward. In other counties, we have interest in Outagamie County, Marathon County, Washburn County, and we'll be pushing it in other places as well as it spreads. And you know, it's not just the cost of health insurance for the counties. That same person that you mentioned, Kay, at the end of her talk about her testimony, her public comment about not being able to retire, and I saw board members move when she said this part, because we're always trying to figure out ways to raise revenue. And she said, and that money that we're spending could have been spent right here in beautiful Dunn County on all the things you can spend money on here. And it's true. It would be such an economy boon. And all these stories we're trying to keep close to us so that we can use them going forward and convince other county boards to follow suit.
You know, we've done a few resolutions here in Kentucky, and we were able to get a resolution in favor of The same thing, national, not-for-profit. It was geared around a specific piece of legislation in a little town in eastern Kentucky called Vico, which Vico stands for the Virginia Iron, Coal, and Coke Company, because the towns are named after the coal who think they own the towns and the people and everyone else. And yet the people of this town passed a resolution in favor of the most progressive, the most thorough healthcare. And I think that that is possible if we had a big enough megaphone and a big enough way that we could talk to the people of our country on the terms you've been speaking on, that it becomes possible to reach there, instead of just talking to a Congress that seems to not be listening to us at all.
Yeah, I think the success of this referendum really depends on how well we are able to get the message out about it. I feel like this is an idea that sells itself. Like if you can explain it properly to people, you know, it's pretty hard to see the benefits. So I think we just need to get out there and get our message out, and I think the rest will take care of itself. But it's going to be hard.
You know, we've seen some statewide referendums that single payer groups have done that in general fail. And what we've seen happening in those is that movements of citizens and residents work to get the question on the statewide ballot. And then the medical for-profit industry, the insurance companies and those others who see healthcare as a way to make profit, come in and do a campaign that destroys the support. And the money that they have is huge in comparison to the money that the movement groups have had. And so we've seen on a statewide basis that the referendum issue hasn't really been something that people have been able to use effectively. I would like you to just kind of talk about how this is different from that.
Sure. Well, this is a non-binding referendum, first of all, so it has no statutory impacts if it passes, which I think makes all the sense in the world, because Dunn County itself can't fix it. It's not a Wisconsin health insurance program that we're looking for. It's a question about a national health insurance program. And what I remember about Donald Trump when he rose to power in the lead up to his victory, I remember one speech in particular, and you probably remember it too, Kay. It was actually an interview, and maybe and you too, Monica. It was probably because I've said it 100 times, but he was, I think, 60 Minutes maybe, and with the due knowledge that this never happened, of course, and that he was probably lying, but he said that everybody's going to be covered. I think Scott Pelley asked him about health insurance and healthcare, and he said, we're going to cover everybody. Everybody's going to be covered. And he said, well, who's going to pay for it? And Trump said, the government's going to pay for it. And he just said it reflexively. And I spoke at that time. I remember speaking to people, and I lived in a different part of the county than I do now then, and which was a very rural part, and that's where the Trump support was bubbling up. And I asked people about that, and they said, "Yo, well, why not? We're spending all this money on wars over here, wars over there, giving it to Wall Street, and these are Republican people, you know." And so I think, yes, if it got big enough, of course, those interests are going to come in and try to squelch it. They're going to try to muddle the message and tell lies about people's taxes and how much they'll go up, and that we can't afford it, and that the government will be telling you what care you can do, even though the insurance companies are telling you what care you can get now. But I think we are at a time in this country where the division that is real, and being pushed, some would argue, by both sides, and because the division actually brings profit to the political profiteers, the consultant class, the people who make all those ads and flyers that you see everywhere. It is real. However, on a lot of issues, the waters are being muddied in the middle, and they're kind of overlapping and going this way and that way. And I feel like if the movement is big enough, and the people with whatever the name of the political parties might be in 10 or 20 years really say why, and you hear this from conservatives now, why are we sending $40 billion a month to the Ukraine, or which is in fact going to weapons manufacturers? Why are we spending all this money here? How can we afford this? And it won't be easy, but I've noticed just in my short time of paying attention to politics that a lot of those issues have shifted. And I feel like this one, which impacts every person directly, can be one of those key ones that shifts, where whichever political party wants to seize on it when there's enough pressure from below, then they will win. And they know that we can afford it. And it's got to start somewhere. And we're hoping that it starts in Dunn County.
Wow. I hope it starts there too, and all across the country in similar counties and in similar ways. And it's true, I just saw this morning that, what is it, another 675 million to go to the war in Ukraine. And it seems that both political parties are pretty much in agreement that that those things are necessities and that our healthcare is not. And we're really struggling with the privatization of Medicare that has been happening, and a program was started under Trump, and that has continued under the Biden administration. And we're hopeful that the people of the country can do something to mobilize people's love for Medicare and for what it's the best we have in the country, even when it's not adequate, but it's the best that we have, and it is publicly funded, and it has given us to some extent a model of public funding and covering everyone. But the privatization is happening with both parties seemingly in agreement that that's the direction we want to go. So it's refreshing to hear that there are some grassroots somewhere in other levels in our country that have some vision to take us in another direction.
Yes, and that one of the names of that program that you're talking about, the direct contracting entities, or DCEs, was also under the purview or under discussion in our Wisconsin Revolution's healthcare committee just a few months ago. And the same people, same group of citizens in Dunn County, among other people across the state, put together a Zoom call with Senator Baldwin. And we had speakers speak to her for a few minutes with their stories of the Medicare privatization. And she listened, and we were really well organized. I think there were 60 people on that call with her. And she had heard of the program, but didn't really make a public comment about it. And because of that meeting, she wrote a letter to Senator Wyden, who is the Oregon senator, who is the head of the Finance Committee in the Senate, calling for a hearing on the privatization of Medicare. And we still haven't heard back from Wyden about Baldwin's letter. But again, like it's an interesting political topic, privatizing one of the most popular programs, but nobody wants to touch it, and they won't until we make them.
We have to make them, because it's this is a program where seniors can get put into plans where they have, without their consent, and those plans have for-profit middlemen in the middle, private equity, venture capital, et cetera, making a ton of money, and even with the ability to make even more. So that's important. It's difficult to simplify. Maybe Dunn County can help us to put the language of how we fight against the privatization of Medicare and against direct contracting entities into language that we can reach the hearts and the humanity and the compassion of the people within our country. So I'm inspired by the work that you are doing and so grateful that this has started in Dunn County and that we have such beautiful spokespeople to carry it forward, and people who have faith that the people at the grassroots of our nation are people with conscience and compassion and the ability to respond in a humane way to solve the problems that all of us face. So I think that the way we will break through on the things that we are stuck on in the nation is that healthcare may be the first place we do that, because it's so close to people, and all of us have bodies and have people who we love and care about, whose lives are at stake in this situation. Anything else you'd like to tell our listeners? We have a few more minutes to get the case in. If you want to give contact information, I invite you to do so. You don't have to, but you may if you like, and to tell us anything else you'd like to tell us about this story.
Well, I just wanted to say that for me, something that felt so special the night that we passed it, unanimously passed the referendum. There were a couple of conservative members of the board who came up to me after the meeting to thank me for my comments and to say that they agreed. And I was just flabbergasted, you know, and they shared their own stories about like being small business owners, for instance, and having to worry about insurance for themselves and their family, and, you know, there not being any good solution here. And so, yeah, it just really impressed me that this has become truly a bipartisan issue. It's, you know, you talked about all the different stories, and it's sad that it's gotten to the point where everybody has these stories, you know, and so I really hope that people keep those stories in mind, you know, because I think that there, you know, probably will be a campaign against this, you know, funded with a lot of money. And I think that if people just keep in mind their reality and the reality of their friends and family, I hope that we can be strong, right, against those negative campaigns.
Ultimately, people are stronger than money, right?
Yep.
That's right. You want to hope so. And just talking with your neighbors will keep you inspired. And yeah, I would share the website of this group that's helping to organize this. And I think it's also perfect. And the group is called Our Wisconsin Revolution, the word OUR. And the website is ourwisconsinrev.com. But if you put Our Wisconsin Revolution in the search, it'll come up, and you can donate some money to help push this forward with the small staff that they have, or any way that you want to help. You can see it on there. But I would say that it's perfect that while Our Wisconsin Revolution, this language of this referendum was born in their committee, they put no money into it. They didn't have a really coordinated effort from that group, specifically in the county. It came from the people of the county, and that's an interesting thing that we as an organization have to figure out how to do too. Is you know, these counties have a lot of pride, and if we're taking it to a northern county or a southern county, and we have people from, you know, other Wisconsinites, but maybe not local people coming in, they'll raise some eyebrows and be skeptical. So it's a challenge, and a welcome one, to have to find local people for each local county and appeal to them to do the same thing. And that's what we're trying to do.
I'm interested, Monica, you said you were a union representative at where you work. Could you tell us what union you're in?
Sure. So we are a local of the American Federation of Teachers. We are local 6503. We call ourselves Stout United.
You call yourselves what?
Stout United. So the name of the school is UW Stout. So we are Stout United.
I see. Are there other unions in the county?
Oh, gosh. Let's see here. The K through 12 teachers, they have their own union that I know of. My mind is blanking. I know, of course, there are other ones.
Yeah, we, you know, we worked very hard for a very long time on getting union locals to endorse HR 676, which was the national single payer bill at that time. And the wonderful teachers of Wisconsin were so great in that. There's a retiree now named Buzz Davis, who we're still in touch with, who did a lot to move the locals of the teachers of Wisconsin and leading the labor movement to come on board with helping out on this topic.
We had several members of the Ask Me retirees be a part of both our campaigns, the meeting with Senator Baldwin and this one in Dunn County. They've been a big help to this too.
Yeah, the union folks are important. So if the union people together with the rural counties like yours can get together and do something about the healthcare, we may find our way to eventually get a healthcare system that works for all of us and that doesn't cost us an arm and a leg as we go along. You've been listening to John Calabrese and Monica Barrier, who are members of the Board of Supervisors in Dunn County, Wisconsin. They have put on the ballot a referendum for November that will ask the people their opinion as to whether the federal government should enact legislation that would assure nonprofit healthcare for every single person within the country. And we're delighted that you accomplished that successfully. And we appreciate that you have taken the time to be on our show. Thank you so much. And we wish you all of the best in your efforts to talk to your neighbors and to win this referendum that comes up in November.
Thank you, Kay. It was great to be here. And also thank you for helping to get the word out about what we're doing.
Oh, we're trying. I did write an article about it and managed to get that published. So I think that we're trying to get it around because a lot of people think that this is a fantastic idea. So thank you so much.